First of all, we had to first look at definitely the market and where it was, failing, not only in the, from the providers, EMR systems and, just from the healthcare engagement, but where was that, extended engagement, have its gaps. So we started looking at that, and then we started looking across what care segments of those models were important. Was it going to be around chronic care? Was it going to be around, different, just general medicine? Where were the actual key determinants around if I'm going to be an ER physician and I'm transitioning somebody out of care and they're going to go back to their GP and their GP needs to follow up with them and keep an extended engagement with them. What kind of model was that? What kind of care was that really focused around? Was it cardiology? Was it neurology? Was it whatever? So we really kind of started looking at where those identifiers were initially. Don't get me wrong, there you could probably try the telehealth RPM across so many segments, but it's really where's the value. So if I'm we really focused on the chronic care, diabetes, COPD, the top 3 key issues around social determinants on the major scale. Then we got into the specific markets around cardiology, and it was also driven by the types of clinical solutions that we could actually bring beyond telehealth, that we could also connect around the remote patient monitoring. What would give the additional information to the provider? So that was kind of the criteria that we used to kind of look at that information. And we kind of built out a grid that kind of said, this is where the key areas that we need to play in, where those basic, factors, derive from, where the influences were, and then how the value of that was going to actually show itself, not only from a reimbursement and things like, that the organizations wanted to achieve, but also around their care improvements, reaching those patients and improving that extended care. Because when you look at rural FQHC, rural markets, I'm not talking about big city, health markets. There are a lot of challenges. I mean, I talked with a hospital group that was sending a bus out 90 miles in different directions to work with cardiac patients to get a checkup, that they sometimes were able to see the patient, sometimes the patient was able to get there. Instead of looking at, hey, why don't we put you on a platform that involved, I can engage with you in these many appointments a week or a month. I can also monitor based on, the type of condition that you have. And then I can also have alerts around if a change of condition occurs. So those were our factors, looking at the requirements, the key market drivers, and where we were going to add value. And then from a platform, we were able to extend our technology in those focused areas to ensure that we achieved what we were trying to.